catheter specimen urine station, safety checks and identity checks of the patients have been done. So I will start the station by doing my hand hygiene, using a hand gel, following WHO steps for hand hygiene. Palm to palm, back of the hands, fingers interlace, fingers interlock, rotational cleaning of thumb, fingertips, and let it air dry for 30 seconds. Now I can proceed to my patient to explain and gains consent. So, hi Jane, my name is Paula.
Hi.
How are you?
I'm good.
So, I am here today to get a catheter specimen of urine from your catheter. Because you've spiked a temperature last night, so the doctors are a bit worried about this. So Jane, what I'll be doing is I'll get a sample from the sampling port of the catheter. This procedure will take about few minutes, and this will not be painful. Am I getting your consent for this?
Yes.
Thank you. So you have the call bell. If you need anything or any assistance, please feel free to press that and I'll be happy to help. Meanwhile, I'll just prepare the equipment that I need for the catheter specimen of urine. Thank you. So I'm going to be preparing my equipment for catheter specimen of urine. So I need to do my again. So I will be using a disposable tray that is visibly clean, and I'm happy to use that. I have here my specimen pot, dry and intact packaging. I have here my incontinence pad, dry and intact. So I have here 2 Clinell wipes, which is dry and intact packaging, expires 2025-3/7. I have here my non-traumatic clamp, just if in case that I need to apply a clamp into the catheter tubing. 10 ml syringe, dry and intact packaging, expires 2025-4. Now that I'm sure that all my equipments are sterile and with dry and intact packaging, I'm happy to proceed to my patient. So hi Jane, I'm back. I have the equipments for the procedure. So are you happy for us to proceed?
Yes.
So I could see that there's no visible urine in your catheter tubing. So I need to manipulate the catheter. Is that okay with you?
That's fine.
So I'll just do my hand hygiene again. And I'll be wearing my PPE to manipulate the catheter. So Jane, if there's any discomfort during the procedure, please feel free to tell me, and I'm happy to stop or pause for a while. Okay?
Okay.
So Jane, we normally manipulate the catheter just to check if there's any kinks or coils that impedes the urine passing through the catheter tubing. Is that okay?
Yeah, that's
so.
fine.
Am I okay to just lift this blanket and
Yes.
just expose the catheter for a bit? So, okay. You could see that there's no kinks or coils in the catheter. So, I need to just apply a non-traumatic clamp that's already here. And I'll make sure to clamp it few centimeters distal to the sampling port. Okay, before I clean the sampling port, I'll just have to put this incontinence pad just to prevent any soilage or spillages in the sheets, okay? So, right, I'm just gonna change my gloves, just do my hand hygiene again. So Jane, I'll be wearing a new set of non-sterile gloves so I could clean the sampling port with Clinell wipes for 30 seconds. And I will let it air dry for another 30 seconds before I get the sample from the port. So I'll just make sure I fully open the clinell wipe and clean the sampling port for 30 seconds, okay? Just make sure I clean the rubber sampling port. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. I'll just let it air dry for another 30 seconds. Now I'll be getting my 10 ml syringe. So because I'll be using a needleless system, I will make sure that I insert the tip of the sterile syringe into the center of the sampling port, and with non-touch technique, I'll be getting 10 ml or 10 ml of urine from the sampling port. So I have 10 ml of urine from the sampling port, and I will now be transferring it carefully, making sure I don't touch the tip, to the sampling pot. So that's 10 ml of urine. Discard it to the clinical waste bin. I'm gonna make sure to seal it. So Jane, what I'll be doing now is, because I've got the 10 ml of urine already, I'll be cleaning the port again for 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. So that's done. And I will release the clamp again and remove this incontinence pad. So how do you feel, Jane?
Not too bad.
That's good. So I will be just disposing of my equipment, and I'll be removing my PPE, and I'll be putting a label with your correct details and complete details into the sampling pot. I will put it in a microbiology bag and send it to the laboratory, okay? And I'll make sure to inform the doctors of the results, so they will make a treatment plan for you. Is that okay?
Yeah, that's fine.
Thank you for your time, Jane.